My name is Kajira K. Mugambi. I'm the founder and president of a charitable organization called HopeCore International. I grew up in a very poor village on the eastern slopes of Mount Kenya, in a poor village, in a poor family. I decided to start HopeCore after studying and living and working in the United States for many years. And at some point, recognizing the fact that out of the suffering and the degradation of poverty and disease where I was growing up, a dream was conceived in me. And that dream was to leave the United States and come back to that village and do something about the challenges that I experienced in terms of poverty and disease. I remember times that my family, my brother and sister and I would go without food for even a couple of days. We'd get so hungry that we'd fill up our tummies with sugarcane and water, and I would get very, very sick because that was polluted water. I would end up traveling with my mother for a distance of close to 4 miles to the nearest hospital, stopping several times just to rest because I couldn't walk that much when I'm sick and hungry. And so that really planted that seed of dealing with the issue of health prevention. I had to drop out of school after class 5 because my parents could not afford to pay my school fees. I ended up getting a job as a farm worker, milking cows and feeding pigs and cleaning pig pens in order to earn what was 15 shillings a month, which was $2 US dollars at that particular time, in order to earn money to go back to school. So that basically caused me to be very, very committed to poverty eradication, and I felt that if I can just prevent 1 or 2 children or 2 families from going the experience I went of getting out of school at such an early age, I would get the fulfillment. Fortunately, through Dr. Philip Rasori, who I met when I went back to the city of Santa Rosa, where I'd gotten a lot of support during my educational process, he decided to come and visit Chogoria. And since 1986, when we met, we have been connected and been working very closely together since then.
My name is Dr. Phil Rasori, and I've had the privilege of being contacted by Dr. Mugambi to do the design of the healthcare program, as well as helping on the microenterprise design. HopeCore International's program is focused on the slopes of Mount Kenya in approximately 500 villages. Those 500 villages have a population of around 200 to 250,000 villagers. We are right on the equator. We are in a lovely area of tea plantations and coffee farms. The people in our program live on small plots of land, usually an acre, possibly 2 acres. They grow tea, they grow coffee, they grow corn, they grow potatoes, they grow bananas. Over the last 16 years, we've had a major growth in our project. We started in the year 2000 with only 12 poor village ladies and $5,000. In 2017, we have 50 employees. We offer services to over 100,000 women and children. We are in a whole school district, which is comprised of approximately 200 schools and has an enrollment of 45,000 children. We've increased our budget to about $650,000 in 2017.
We recognize that money alone cannot eliminate poverty. So HopeCore is very, very committed to what I call health and sustainable livelihoods. So we have the image of the 3-legged African stool of poverty eradication.
Education, health, and economic development. If you pull out any leg from that 3-legged African stool, the whole stool collapses.
The first leg really represents the idea that we feel to make people self-sufficient, self-reliant, we need to help them to learn how to actually sustainably earn a living. So we provide loans that help people to start microenterprises, and then we provide them with technical business support during the loan period to improve the chances of basically sustainable income generation for them.
We've maintained a repayment rate greater than 92% over 16 years. 92% repayment rate is much greater than any loan repayment rate within the United States, whether it be car loans, home loans, or anything else. economic benefits are seen immediately, and we knew that before we could add in education and healthcare, we would have to gain the confidence and trust of these villagers that really knew in the year 2000 very little about our organization. But a milk cow and the milk that that cow produces is something that a family can understand. The husband, the wife, the children, they see the effects of that.
Actually, it has done quite well to me. I am the secretary of the group, and I'm training them how to cope up with the business that they have started. Most of them they have started a dairy cattle farm, and I'm following up what they are doing because they started in one cow. Most of them, a number of them now, their cows have given birth.
Some of our people have over 100 chickens that lay eggs, and they sell those eggs in the community. The second component is disease intervention modalities, and we have been a historic leader in Kenya in those. And the first one is clean treated drinking water systems. So the harsh reality in Kenya is these were children that were unable to wash their hands, and they were drinking polluted water. And our nurses, as they came to the schools to see the sick children, found a huge amount of diarrheal diseases. So HopeCore, partnering with Children's Hunger Relief Fund, put clean drinking water systems in a whole school district of 182 some schools. We were honored by the Ministry of Education in that of the 12 million school children that are now in Kenya, our school district is the only one that has a clean treated drinking water program for all its schools. We also put out hand washing facilities with soap in all those same schools.
My name is Ann Gilday. I came over to Village HopeCore in 2014 as a Global Public Health Fellow. Our health program is integrated, it's comprehensive, and it's community-based. We give mosquito nets to every child entering the school system, so every kind of kindergarten age student gets a mosquito net when they start school.
About 4 years ago, we began to have a school mobile health program whereby every school of 184 in our school district gets one health day every term. There are 3 terms a year. So in that health day, we then arrive at the school with our full team, which consists of 2 nurses, 1 trained health educator, and about 4 community health workers. We have basically no brick and mortar expense. So many nonprofits get hooked into building expensive clinics and hospitals and other things where we actually use the facilities within the schools, within the churches. We bring tents to the market days, so that makes our program extremely cost effective.
We offer them clinical services, we offer the teachers clinical services, and we invite mothers and their under 5s to come for clinical services and health education as well. We offer family planning methods there, and we do growth monitoring and immunization checks.
And we're really covering a woman and a child from the time she delivers all the way until the child is 17 or 18 years old.
Our community outreach program recently launched. We go into markets on busy market days and offer HIV testing, blood pressure testing, and blood glucose testing.
The third leg really represents the idea that even with the 2 legs being in place, if people do not have the technical knowledge they need to prevent disease or entrepreneurship and so on, as well as attitude change, because people are poor substantially because of the way they think.
Education basically underpins all of preventative health services. If you don't know how malaria is transmitted, you don't know why you should use a malaria bed net. If you don't know how vaccines work, you don't bring your children to get vaccinated. If you don't know what clean drinking water is, then it's very hard to choose what water to give your child. Before HopeCore was in the schools, there was absolutely no health education whatsoever.
So our health education is also kind of the hallmark of our health program. So at every point that we offer services, we also offer health education. We do health days where we teach health education to primary school and secondary school students. We have a sexual and reproductive health program where we train youth to be peer educators on sexual and reproductive health issues. Through that, we also have a youth center that provides a safe place for youth to come and access Wi-Fi, career resources, and family planning.
After all these years, the one number that correlates best with under 5 survival is the educational level of the mother. It's not the amount of physicians available, the amount of clinics, the amount of medical care.
All of our donations are really spent here on the ground, helping people in our community and empowering our staff. So our board is completely volunteer-based and no funds are spent in the United States. And that is different than a lot of other organizations who spend, 15 to 20% on their headquarters in the U.S. Our headquarters is in Chogoria, and people are always so surprised by that. Where else are you? This is our headquarters. This is where we're based. Our staff is local. We are 98% Kenyan national staff. They're amazing. They're the most dedicated group of people I've ever worked with. It's really the teamwork and the intersection of all of these hardworking individuals that helps the organization to stay on track and then to grow, offering more impact across the community.
As a nurse, we see our patients in our office clinic in the morning. Then we go out in the field whereby we do school health program, we do mobile clinic, we see sick children.
Being a clinic officer with Village HopeCore has been awesome. I've learned a lot. I've been able to help so many people, and I feel good about it.
We're also really hoping to start to showcase our programs on a more national level. If we can showcase our programs and start showing others how cost-effective it is to provide clean drinking water to students, then maybe other counties would start to implement their own programs, whether it be NGOs, nonprofits, or even the government.
Any nonprofit that exists for 16 years in Africa has beaten all the odds. The numbers are that for every nonprofit that is started, approximately 80% of them are gone in 5 years. In 10 years, there's less than 5% of them are still in existence.
Chogoria in general is thriving, and it's been a really exciting thing to see the community grow and be empowered as we would hope. It's been amazing to really see a community-based healthcare and poverty eradication system implemented on the ground at the grassroots level. At this point, we're on such a good track, and we'll be able to keep growing and really having a bigger impact on the community.